Doc, a very good morning to you, and thanks so much for your time. And yes, we've been hearing more and more the issue of breast cancer in men, or the incidence of breast cancer in men, coming up over the past couple of years. Now, with that being sort of a talking point, with us talking about it more, are we seeing more men coming in for checkups? Are we seeing more men being diagnosed as well in over the past couple of years?
Yurika, good morning. Good morning, listeners. The answer to that is yes. But this is mainly an age effect because after AIDS has been conquered, we are seeing now more men getting older, and breast cancer in men is primarily a disease of the advanced age, as pointed out.
But let's look at, what might lead to it when it comes to the differences when we look at breast cancer in women and men. Women, we often hear, yes, it could be hormonal, it could be genetic, it could be where you're on contraception, have you had a child, so many different factors. So when it comes to men, particularly in that age, can we pinpoint what it is, that the common causes of breast cancer?
No, we cannot. It's a much less common disease in men than in women. If we take 1,000 women, about 100 of these will develop breast cancer during their lifetime. If we take the same amount, 1,000 men, only one will develop breast cancer. And therefore, there's relatively little good research available about it. It's just too rare. What we do know, however, is that genetic causes are much more common in men because they drive a very high predisposition to breast cancer. And if we test, like for example at our institution, men with advanced genetic methods, we find that there's an underlying predisposition on about 2 to 4 out of 10 men, whereas for women it's less than 1 out of 10.
And when it comes to detecting breast cancer in men, same procedure, you do the same kind of checks, the same kind of feeling around for a lump that shouldn't be there?
In essence, it's the same. Obviously, due to it being so rare, we don't run screening programs for men. Men usually come with a lump in their breast, and men are not very well known for their health-seeking behavior, in contrast to women, so they usually come with more advanced tumors than women.
Okay, so what are we seeing happening as a result? Are we seeing more men dying from breast cancer?
With modern treatment, the outlook for breast cancer also in men has greatly improved, and these days the majority of men we can actually cure. Only the very neglected breast cancers will still die of their disease.
In terms of other risk factors, Doc, just give us some idea of what it is that would fall into that list.
Yes, obviously we have alcohol abuse, obesity, and certain genetic abnormalities, like for example Klinefelter syndrome, but these are rare. Anything that increases female hormone production in the male body, like for example liver cirrhosis, is said to increase the incidence of breast cancer in men. But once again, due to the fact that it's such a rare disease, it is not that well researched.
In terms of the treatment that you made reference to not too long ago, just give us some idea. You say with modern treatment, yes, you are able to treat them successfully. Is it the same kind of treatment that women would have? Does it differ slightly because of differences in hormones and things like that? And do the side effects differ as well when it comes to men?
Yes, the treatment principles are in essence the same. We're talking about local treatment, surgery and radiotherapy. Surgery in men will always be a mastectomy. Breast-conserving therapy, due to the small size of the breast, is generally not feasible. And in contrast to women, and the lesser importance of the male breast for sexuality, we do not do breast reconstructions, which is also quite obvious. Then many men get radiotherapy due to the fact that they present with locally advanced breast cancers, and this is done to control the cancer locally on the chest wall. As to what concerns systemic treatment, meaning treatments that are working throughout the entire body, like for example hormonal treatment, chemotherapy, and biologicals, they follow the same principles as in women. For hormonal treatment, we have long used tamoxifen. It's an anti-estrogen that is available in women too. And we have not moved yet to so-called aromatase inhibitors, which in women have been found to be more active because the hormonal environment in men is different.
And just a word then, I suppose, Doc, to younger men. I mean, often when it comes to women, they say if there's been a history, if it's your mother or your grandmother or an aunt who's had breast cancer, then you really need to be on the lookout and be more vigilant. Would the same apply to males as well? If a father or a grandfather has now had breast cancer, the same warning to younger men in those families?
Yes, especially also to women, because if a man suffers breast cancer, then it is a warning sign that the women in this family might be at increased risk, and therefore genetic testing in men is absolutely mandatory, irrespective of the family history. Obviously, every man who develops a lump in the breast should seek medical attention. And unfortunately, now due to the corona epidemic that you have alluded to in earlier remarks, it is actually very sad for us to see that men especially are reluctant to see us doctors, and women also. And this places cancer therapy at a disadvantage of the last 10 years of progress that we booked, we estimate. And that's very tragic because cancer will kill you.
Yeah.
COVID-19, you're usually going to survive.
Yeah. Well, I suppose, yes, people need to not ignore whatever else is going on in their bodies at this time. Don't just be looking out for symptoms of COVID-19. Thanks very much, Dr. Justus Apffelstaedt, for that very, very interesting chat there. Breast cancer in men, don't ignore.